We all experience moments of sadness. Life throws curveballs, disappointments happen. These feelings are normal, they are usually temporary. But what if the feeling of sadness lingers? What if it starts to interfere with your daily life? This could be a sign of clinical depression. Clinical depression is not just feeling blue. It's a serious medical condition that affects the brain. Feeling down is like a passing cloud. It might bring a bit of rain, but the sun will soon peek through. Clinical depression, on the other hand, is like a storm that settles in. It darkens the skies and disrupts everything in its path. Understanding the difference between these two states of being is crucial. It's the first step towards seeking help and finding lasting relief. Many people try to cope with the persistent darkness of depression alone. They may feel ashamed or fear being judged. However, it's vital to remember that clinical depression is not a sign of weakness. It's a medical condition just like diabetes or heart disease. And like any medical condition, it requires proper diagnosis and treatment. Recognizing the difference between transient sadness and clinical depression is the first step towards healing. It allows individuals to seek professional help and break free from the shadows that cloud their lives. Remember, you are not alone in this journey. Clinical depression, also known as major depressive disorder, is a mood disorder. It causes a persistent feeling of sadness and loss of interest. It affects how you feel, think, and behave. It can lead to a variety of emotional and physical problems. Clinical depression disrupts your ability to function at work, school, and home. The causes of depression are varied and complex. They can include genetic predisposition, brain chemistry imbalances, stressful life events, and underlying medical conditions. Imagine a delicate balance within the brain, a symphony of chemicals that orchestrate our emotions and thoughts. In individuals with depression, this balance is disrupted. Levels of neurotransmitters such as serotonin, dopamine, and norepinephrine may be altered. These chemical messengers play a crucial role in regulating mood, sleep, appetite, and concentration. When their levels are disrupted, it can lead to the debilitating symptoms of depression. Clinical depression manifests in a multitude of ways. It's not just about feeling sad. Recognizing the diverse range of symptoms is essential for early diagnosis and intervention. If you experience several of these symptoms for more than 2 weeks, it's crucial to seek professional help. Feeling sad, empty, or hopeless most of the day, nearly every day. Loss of interest or pleasure in activities you once enjoyed. Significant weight loss or gain, or changes in appetite. Difficulty sleeping or sleeping too much. Fatigue or loss of energy. Feelings of worthlessness or excessive guilt. Difficulty concentrating, remembering things, or making decisions. Restlessness or feeling slowed down. Thoughts of death or suicide attempts. Section 4. Breaking the silence. Seeking help and support. The stigma surrounding mental health often prevents individuals from seeking the help they deserve. It's time to break the silence. Talking about mental health is not a sign of weakness, but a sign of strength. Reaching out for support is the first step towards recovery. Imagine a world where we treat mental health with the same compassion and understanding as physical health. A world where seeking help for depression is as natural as seeking help for a broken bone. Open conversations about mental health are crucial. They help to dismantle the stigma and create a supportive environment where individuals feel safe to share their struggles. When we share our stories, we realize we are not alone. We break down the walls of isolation and create a community of support. Section 5. Hope on the horizon, treatment and recovery. There is hope for those struggling with depression. Various treatment options are available, and with the right support, recovery is possible. Treatment for depression often involves a combination of approaches tailored to the individual's needs. Medications such as antidepressants can help to rebalance brain chemistry. Therapy such as cognitive behavioral therapy or interpersonal therapy provides individuals with coping mechanisms and strategies to manage their condition. For severe cases of depression, electroconvulsive therapy may be recommended. ECT involves a brief electrical stimulation of the brain while the patient is under anesthesia. It can be highly effective in treating severe or treatment-resistant depression. Remember, seeking help is not a sign of weakness, but a sign of strength. With the right support, recovery is within reach.